We will begin in just a little while as our live viewers are joining us.
Okay, welcome everyone. Thank you for coming today, this Friday. Just introduce myself. My name is Peishan Wen, and I'm co-chair this ACRM, CIRM networking groups webinar. I am associate professor at the Occupational Therapy Department, Georgia State University. And now I'm gonna ask Matt to introduce himself.
Thank you, Peishan, and I'm Matt Erb. I am a physiotherapist located in Tucson, Arizona. I have a clinical practice here. I do a lot of work with the Center for Mind-Body Medicine, as well as some adjunct teaching at various departments at the University of Arizona, including the Andrew Weil Center for Integrative Medicine. So very excited to be here with you all. And our speaker today is Rachelle Tsachor. No, I'm not pronouncing that quite right as we discussed, but the topic of our discussion is on the Laban movement system in mind-body research. And we're going to have a full introduction, a full bio of Rachelle in just a moment. But we'd just like to go over a few housekeeping items first before we get started. We do want to advise that the meeting is being recorded. Our talks get posted to the ACRM YouTube channel where they receive a lot of views and attention after the fact. We want to ask all attendees to stay muted, keep your phones or mics muted as well. We do expect to have a little bit of time at the end, usually 5 to 10 minutes, to have some discussion, answer some questions. If you have any questions as you're hearing the presentation, please type them into the chat, but we'll also open the floor for live questions at the end as well, and we'll address as many as we can. One additional tip, once Rachelle puts up her slides, you can resize the portions of your screen that show the speaker's video on one side and the speaker's slides in the other. So know that you can adjust that by using that slider bar. So I'm going to turn it back to Peishan.
With that, it's my pleasure to introduce our speaker today, Rachelle. Rachelle Tsachor is Associate Professor of Movement at University of Illinois, Chicago. She's a certified Laban, Bartenieff Movement Studies, Mind-Body Medicine, and Alexandro Technique. She analyzed pattern in moving body in diverse projects, research movements interaction with our emotion, health, and learning. Her clinical insight as a registered somatic movement therapist are published in Laban Bartenieff-based somatic movement therapy, methodology, and case study, and in integrative rehabilitation practice, foundation of whole person care for health professionals. With Laban as a tool to research connection between motion and emotion, Rachelle and Sheffield together published Emotion Regulation Through Movement and How Should I Count the Way, a method for quantifying the qualitative aspect of unscribed movement with Laban. and a somatic movement approach to fostering emotional resiliency. Their research applied to fields such as robotic and intelligent interaction and has led to several projects funded by the National Science Foundation. I look forward to your talk, Rachelle. So now I'm going to turn the time to you.
Thank you so much, Matt and Peshan. Can everybody hear me? Just you can nod if you can hear me. Great. So hi, I'm Rachelle Pelnick Tsachor, and let's get started. Because movement is one way we respond to our needs, I invite everybody listening to this webinar to get up and move anytime you like. Take care of yourselves or be still, whatever suits you. And here we go. I teach at UIC, the University of Illinois at Chicago, which sits on the traditional homeland of the Three Fires Confederacy, the Potawatomi, Odawa, and Ojibwe nations, as well as the Menominee and the Ho-Chunk, who, along with many indigenous people, were among its first inhabitants. With respect and gratitude, we honor the many Native Americans who have, do, and will call this land their home. And if any of you would like to take a moment to honor the indigenous peoples of the lands that you are coming from, this is a great way to start off any learning activity that we do at UIC. This ACRM Complementary and Integrative Rehabilitation Medicine Interest Group already recognizes that physical rehabilitative medicine and psychosocial spiritual aspects of the whole person are interrelated. Because we move to meet our needs, movement itself is a single factor touching on all of these aspects. As we interact with our environment and others, movement is our outer response to our inner needs, and it also influences our own inner processes. For care providers, such as those people listening today, a comprehensive system capable of perceiving the relationship between the functional aspects of human movement and the expressive aspects and how these two interrelate can really facilitate how we lean into movement as an integrator for psychophysical dimensions of each individual. And it can be quite important for rehabilitation at the same time. So I'm going to introduce a comprehensive taxonomy of movement that we can use to perceive both functional and expressive aspects of movement. Let's see if I can get this slide to change. Good, here are our learning objectives. We'll be covering the Laban Bartenieff movement system as an interdisciplinary mind-body language useful for both physical rehabilitation and psychosocial support. As you listen, see when these narratives suggest ways that are useful for you to view movement in support of agency and well-being. Once we get this overview, we'll actually explore it physically. If you're willing, at home, you can do it with your hand or your whole body, whatever you feel like. And I'll share some case studies and we'll take a look at rehabilitation practice. And then I'll share some of my research. By the way, the photos that you see are of my former students and colleagues throughout this slide. And so now this is also being recorded. Good. And here's how we're going to do our webinar. Yeah, I think that speaks for itself. At the end, we'll have time for questions and discussion. Good, so let's start with a few definitions. It's a long name, the Laban Bartenieff Movement System. It's a comprehensive, internationally recognized system for observing, understanding, moving, and integrating the elements that comprise the scope of human movement. You might be more familiar with shorter names such as Laban Movement Analysis, Laban was a thinker at the beginning of the 20th century who provided a single taxonomy for both functional and expressive movement. Irmgard Bartenieff founded Bartenieff Fundamentals as a rehabilitative practice to leverage the LMA for integration. What's important for us to know is that each person, from the vast scope of ways that people can move, each person combines different elements that are useful for them in meeting their needs. And these patterns often reflect their personal and community values. So let's talk about this as a descriptive system. Here we've got two aspects of space, of Laban looking at space and movement in space. We'll take a look at that later. But what's important for us today is that just as spoken language communicates meaning through its parts, their images, grammar, verbs, adverbs, adjectives, and so forth, the Laban-Bartenieff movement system identifies a lot of basic components in some big categories, and these work together like a grammar of human movement. It's really similar to music theory, where we see the basic elements unfold over time to help us recognize patterns in a piece of music. When we look at movement, we're looking for patterns of exertion, recuperation, coordination, harmonies or dissonance among body parts, and efforts and organization in the movement. And this helps us to imagine some new options. This comprehensive approach is flexible enough to be used by actors, anthropologists, dancers, musicians, physical and occupational therapists, psychologists, and singers, just to name a few. And right now I'm doing research in AI with this system. So it's really a lovely system that can cross disciplines. It helps us support our very human common experiences and can help us understand our own quirks and our own values. All right, so here we are. We're going to learn a little bit about the system. Take a look at these categories. When we see movement, we might observe what is moving, how it moves, where it moves in space, and we might even try to understand why the movement is the way that it is. So our system starts by organizing its taxonomy into these larger movement categories that can help each of us know what we're seeing or what we're doing in movement. Each physical movement category can reflect and influence a process that we often attribute to the awareness of the mind or the larger whole self, such as sensing, feeling, thinking, and relating. So let's take a moment to just experience how this works and explore this in ways that serve your needs or seem right to you. So if it suits you, take a moment to notice your body and its actions. I'm noticing that I'm sliding off my chair. What parts have your attention this moment? And why do they have your attention? Take a moment to sense another part, maybe that didn't have your attention. And what happens if you notice another body part? Take a moment to sense your weight resting on the support of the chair, or if you're standing or lying or leaning. I'm becoming aware of the support of my arms on the table as well as the back of the chair. Take a moment to move your limbs a little bit and notice what changes as you do that. Maybe shift your weight or change your support. Maybe you want to stand up, or maybe you want to lie down, or maybe you want to sit back down. So take a moment to just see what shifting your weight and your support does for you. The next thing we're going to explore is what's going on between our head and our tail in our spine. So go ahead and just see if you roll down or up or rotate, extend or flex, what you're able to sense as you begin to move that body part. Right, we're going to take a look at some coordination right now, you might want to open up the right side of your body and close the left side. Just see how that feels. If you change that organization of your limbs and your whole. You might want to try crossing or narrowing your lower body and spreading your upper body. Or you might want to narrow your upper body a little bit and spread your legs. And just see how changing your shape affects your body. Let's take one more little bit of movement right now. Let's just think about some directions, maybe up or down. Leaning on a diagonal, or maybe actually going quite forward. And just see how those changing your directions in space affect you. All right, let's take a moment to imagine that you're relating to something, a thought. What's on your mind? Does it make you feel like you want to shrink a little or grow? Stand taller? Maybe just back away from it or lean into it. Yeah, so these are all different ways that we talk about movement as ordinary human beings. And the Laban Bartenieff movement system can help us begin to see the links between our changes in space and our thinking, or our dynamics of movement, what we call effort, and our feeling or inner drive. And these are going to help us understand relationships between function and expression. Okay. Once we have names for movement categories that are useful for the many ways that movement reflects parts of our whole, we can start to notice not only the big categories, but also the elements in them and how these change over time, what we call movement phrasing. And phrasing is really important because it has to do with restoring ourselves with exertion recuperation, with exhaustion, with homeostasis, and all the different ways in which we can strain or not strain our organization and our whole self. We might be able to see which elements are being used, overused, or underused, and some new options that we're not using at all that could be supportive. Different disciplines also attend to different categories. If you're a physical or occupational therapist working with physical rehab, you might notice a lot of things about the body. You might notice body parts, the ergonomics of their use, basic actions like sit to stand, reaching, pulling. You might notice how movement is initiated or sequenced along kinetic chains. Maybe the organization of the whole body or connections between body parts or integration of posture and gesture. For those of us who work a lot with emotions and artistic expression, we oftentimes are keyed into the dynamic qualities of phrasing, of force, such as gentle or strong, time, whether something is feeling more urgent or more leisurely, focus, whether something is very specific or quite general, and what we call flow, or the tension of the body that visibly expresses the inner urge to move. These are often considered expressive or emotional qualities of movement, but athletes need to use them. And Irmgard Bartenieff discovered that these were quite helpful when she was working with polio patients in the 50s in New York hospitals to help people accomplish things in a different way than other people might. Let's take a look here at another category of space, which is huge in the Laban system. We're not going to be delving into it in great detail today. And then shape, which is the physical expression of relationship, how the body changes its shape in response to the environment, ways that the body sculpts itself in order to expand or condense, to rise or sink, to spread, enclose, advance, or retreat. As you look at these 4 categories, which ones are you most familiar with in your discipline, and which ones might seem new or interesting for you to pick up a few tidbits about? Okay, here we go. Efforts are quite unique to the Laban Bartenieff system. And it's very, very helpful if we're going to be looking at our research into emotion, the relationship between function and expression later. Effort is the word that is translated from the original German Antreiben, and they express the inner drive to move. It's the feeling or the quality with which a movement is performed. And we like to see these on a continuum from fighting efforts to indulging efforts. So as I talk you through these, you might want to try, especially if your microphone is off, you might want to try just a really simple sentence like, I want to go home. It has some intention to it. And as you speak it to yourself with your microphone off, you might want to try speaking it lightly or gently. Or maybe more forcefully with strength. How does that affect the emotional tone of it? Try it a little bit more indirectly or more with flexible attention, with your attention kind of wandering around. I want to go home, maybe. Or something quite direct. I want to go home. You might try it with different times. So you might be nice and slow. I want to go home. Or you might want to, I want to go home quite quickly, right? And I paired some of these fighting efforts. So I wasn't just sudden there, I was also strong. And then the last effort that interests us here has to do with our attitude, our inner attitude toward progression. We can do it quite freely with abandon, improvisationally, or we can do it with a great deal of control. And all of these affect both our function and our expression. Yeah, so as you're changing this, did the feeling that you have about the sentence change? That's something to consider. And then imagine that you are working with someone in movement and rehabilitation. Do you always have even bound phrasing so that there's a lot of control to the movement? Do you let them play with time, like skipping or jumping? Is it very direct, or is there a sense that the movement is able to change its focus quite freely? And is there a sense of strength or gentleness or lightness as we go? So all of these things can affect the same exercise, allowing the emotions to shift. So if someone comes in with sort of an attitude toward their exercise that it's really hard, they might sink their shape, they might condense a little bit, they might breathe out and start on empty, and then start to bind or control their movement. They're not going to get a lot of joy from that exercise, and maybe they won't continue with it. So sometimes by shifting up the efforts and the dynamics, we can bring a little bit more joy or pleasure to the doing of the rehabilitative activity. This is another of the categories. Shape is a dynamic change in the body's shape, expressed in the full body, or might just be expressed in the eyebrows or in the shoulders, right? It might show us a change of relationship. If you want to take a different sentence, something that you're thinking that you care about right now, and just try it, growing and shrinking, or lengthening and shortening, or widening and narrowing, and see how that sentence feels to you. Ordinarily, when we talk, we're communicating, we're relating to someone else. So there's typically in a conversation quite a bit of shape change. I might lean into you, I might lean back so that I can take in what you're saying. I might open up, maybe because I want to share something, or maybe I want to open up, or I might stop myself from speaking, which might look to you like closing myself off, but really I'm just closing my mouth for a few minutes so I can actually listen to you. We know what we see. We don't always know why people do what they do and what it means. So there's always a good chance that when we start to notice people's shape change, we can ask a question. I think the last thing that I want to say is that there's every person has rhythms of changes. Like if somebody is walking around narrowed the entire time, that's going to be quite fatiguing. But they might narrow in order to focus their attention. And then they might widen to find a new idea and then narrow again to really put that idea in its place. So what becomes all of these components to the Laban Bartenieff system are innocent, just like all emotions are innocent in the sense they're all good. We don't judge any of them. The question is, are we stuck in one and it becomes fatiguing or dysfunctional for us? All right. So once we know the components, we can start to see the rhythms of their change and how we use them to exert and recuperate in a way that allows us not to have an overuse or an overstress syndrome. So some examples that I like to use are, if you were to chop wood all day, you might want for recuperation to come home and play on the computer. But if you worked on a computer all day, you might enjoy chopping wood as recuperation. It's nice and physical. You've been thinking all day. So the what we call exertion and recuperation really has to do with the length of the phrase and the type of effort and shape and action that are going on. We also like to look at mobility, stability rhythm. As this plays out over kinetic chains in the body, there might be one area that's overly stable, another area that's overly mobile, and the whole kinetic chain then isn't working as well as it could. When we're looking at function expression, we like to look at how those two are interrelated. One of my I guess in this context, we would say patients who came to see me with someone with Parkinson's disease who had a really wicked sense of humor. But since the Parkinson's was starting to affect the shape changes of his body and his face as well, people stopped telling him jokes because he didn't like rise up or lean back or have a shape change. He wasn't expressing that he thought it was funny. And moreover, because he couldn't change his own shape, he wasn't getting the feedback from his own body that that the jokes were as funny as they used to be. So he was really missing his humor. Another example might be an inner-outer rhythm where we've got a busy parent who's managing everybody else's schedule, who doesn't take time to feel or meditate or have the time to replenish by having a few moments of going inward. So before I go on, here's some other dualities: self, other, part, whole, macro, micro. Take a moment to take a look at your normal day. Do you exert by sensing? Do you have a lot of emotionality going on in your day, feeling? Is there a lot of thinking, a lot of relating? Of those four categories, what might be recuperative for you? Also, another way to think about this might be to think about one of the patients that you're working with right now. In the rest of this presentation, I'll just call the people that we work with the mover because they're the person whose movement we're looking at. So you might want to take a look and see how much of my day am I functioning, and when do I get to express myself? I work with actors. They do a lot of expressing. Sometimes I just do simple functional movement with them, and it's quite recuperative for them. But for other people who have to function at a really high level without expressing themselves too much, their recuperation might be going into expression. All right, so these are some of the lenses that I'm going to bring now into case studies and also in rehabilitation. I've only got one case study within the time that we've got here. But I'll show some research and I'll give you the title of a study where you can read some other case studies. Okay. So let's just talk one more theory piece. It's really important. How does this help our integrative practice with the biopsychosocial connections, the spiritual connections, and what's happening in the body? Most people generally recognize that if I have a thought or a feeling, it's going to affect my body. For us, a whole person approach to movement in rehabilitation recognizes that the body-mind connection is a two-way street. How often has someone come in and they are just not in a very good mood, and you give them an exercise that changes their movement, and they start to feel better just from that. So it's a two-way street. The thoughts and the feelings that we have can affect our physical expression, but our physical choices can also affect our body mind as well. Therefore, changes to our movement patterns can support changes to our thoughts and feelings, and allowing choice in how we creatively respond to our challenges. Likewise, challenges for our body can affect our feelings and mood, like the story that I just told you about my Parkinson's patient. All right, so let's take a look at how this works in rehabilitation, and then we'll go into a case study. So for me, I use the Laban Bartenieff movement system to support my ability to identify the mover's existing movement patterns. I want to recognize and respect that these patterns are strategies that the mover currently has mastery of. The mover that I'm working with is currently using those patterns to meet their needs. I don't want to take those patterns away until they have some other ways, some other options of meeting their needs. Sorry. I might expand by providing some new movement options to my to the mover I'm working with to help them develop new possibilities of meeting their needs. And then when a need comes up, they can do it the old way, or they can do it the new way, or they can do it 6 new ways. They can do it more playfully, find new examples. Because the body-mind connection is a two-way street, these new movement options also allow the body-mind to change things that were really hard to change when the mover only had access to their old patterns. So I'm ready to go into, and the patterns that we become experts in because we've used them to solve our needs, oftentimes become the very patterns that we can't escape, the patterns we're stuck in, and the patterns that exhaust us. So when we're looking for renewal and to rebalance or back to homeostasis, just understanding how this works can be quite helpful. So I chose a case study here of repetitive motion stress. Injury that has to work with joint and muscle and connective tissue pain, because I know that a lot of people attending this webinar might be dealing with this in their practices. So this is a case study from a publication that I published in 2013. This is a pseudonym. The gentleman that I worked with gave me permission to use the notes from his work as a case study. So Jack is an Iron Man who cannot run. He's a 56-year-old Vietnam War veteran. He reclaimed his life after the war with scholarship in Eastern religions, meditation, and exercise. He bikes about 5 to 7 hours a week, swims 6,000 yards, lifts weights, does yoga and ballroom dance, and his latest passion is the Ironman marathons. Because the presenting problem that he brought to me is a functional problem, I don't necessarily talk to him directly about expression, about past trauma, about why he might be making the choices that he's making. He's coming to me for a limited number of sessions. I think all in all, he came for 8. He had a very specific problem, but because the mind-body connection goes 2 ways, some good things happened. So let's take a look. He had a severe pain at the top of his left hamstring where it inserted that had developed slowly over the last 3 years. In spite of this, he'd managed to run 3 full Ironman races, 2 Olympic races. But since then, he tells me he hasn't been able to run 10 steps. and he's just terribly sad. He's been relying upon this movement to help him access and regulate his feelings and his emotions. So he's just having a really tough time right now. He tells me that both knees have had surgery and that one knee is still hurting him because of misalignment. He tells me that he came to see me because his surgeon offered to break and remake his leg in correct alignment, which he feels would be a really long recovery. And he's wondering if we could look at the movement patterns and see if there's something that could help so that he can go to a race that he's already signed up for. Okay, as I listen to Jack describe his regime, I wonder about his exertion recuperation rhythm, which seems to me to be extreme. Exert until he's so injured that he cannot exert anymore, leaving him miserable in forced recuperation when he can't run. His movement doesn't seem to phrase at all. He seems to utilize only those fighting efforts for a very long time, long beyond the natural exertion recuperation phrasing that my observation tells me could be sustained. The effort phrase that he shows me is one long exertion, using all the fighting efforts, strength and speed and binding. He's really tightening his muscles as he's working and very direct. He's very goal-oriented, and he believes that this is required to succeed in his sport. Jack's mobility stability rhythm allowed me to identify that his agonist and antagonistic muscles, he was so tense and doing so much binding that when he wanted to flex his leg, his hip joint, his hamstring wasn't releasing. And similarly, when he wanted to extend, like if he was biking, he showed me his movement on a bike, his hamstring wasn't releasing when he activated his quadriceps. And this was interfering with the mobility stability rhythm. He couldn't move because he was literally co-contracting opposite muscles. He was overstabilizing out of a sense of feedback that the intensity of the muscle contractions was giving him. Because he wasn't sensing what was going on in his leg, he really wasn't taking time to go inner. So his inner-outer rhythm was also a little bit affected. He's pretty focused on this external event. Yeah. So Jack came to me for 8 visits, 5 one-hour visits and 3 30-minute visits. At each visit, he learned a specific movement option, and we did some work on some patterning, some new patterns. And he also learned to experience his own movement rhythms, to sense what was going on in his body and stay connected to himself and his choices. He was extremely attentive, perceptive, and motivated. Not everybody is ready to do this kind of work in this short amount of time. And he came to each visit having practiced the concepts and patterns, and he brought questions and discoveries from doing this practice at home. Okay, so that's what we did. In the end, this all corrected the forces that he was generating that were misaligning his leg. He learned to integrate sensing and perceiving from the inside to support his outer goals. Breathing became an important tool for him to connect to his inner sensory experience. Let's see if I can. Great. He wrote me a letter. I think he wrote this from his Ironman. He tells me that his hamstring issue is better than it's been in 2 years, 95% resolved, and his knee's doing better. He had to have it aspirated, which helped him get some flexibility back. He felt that the learning to sense and experience his own rhythms and his own movement was helpful to him, that it was crucial. He's right before the race when he wrote me this letter. He felt that this was the missing piece, and all the other care that he was being given was learning about his own movement. All right, well, let's take a look now at some of the research that Dr. Tal Shafir, my research partner, and I have been doing into the connection between motion and emotion. So let's start with what is the function of emotion. Biologists believe that emotion orients an organism to its needs, driving it to action to meet their own need. It's important for survival, well-being, and happiness, which in essence gives us feedback that our needs have been met. So remember these ideas. Emotion connects us to our need, so it's got a purpose, which is to drive us to action. It's not to leave us in emotion. Emotions can build from sensing to feeling to action in space. And when the action completes the cycle, homeostasis is restored. Here's a researcher who talks and who's done some pioneering work on this. I think you all know Antonio Damasio, who describes emotions as action programs. Emotions are complex, largely automated programs of actions concocted by evolution. The actions are complemented by a cognitive program, but the world of emotions is largely one of actions carried out by our bodies, from facial expressions to postures, to changes in our viscera and internal milieu. In a way, emotions are very complex sets of movement behaviors. And we're interested in that because we're interested in the whole person. All right, so let's go back to that thought that emotion is a two-way connection. Current emotion theory suggests that this is a bidirectional event. We can affect our emotional state through postural changes and movement. So as you're looking at these pictures, I invite you to try one of them. What happens if you move like one of these pictures? And you might want to do it slow enough to sense for yourself what happens. So some of these ideas go all the way back to Aristotle, who believed that the purpose of emotions was to elicit movement toward or away from objects. And we still talk about that when we talk about valence. Okay, so move during this PowerPoint. All right, let's talk about some other theories of emotions. The idea that movement is bidirectional is based on Darwin's ideas and the James Lange theory of emotion, which postulates that body responses to stimuli are necessary for emotional experience, and therefore feelings are not the causes of autonomic system activation and emotional behavior, but they are rather the consequences. According to James and Lange, rather than crying because we're sorry, or striking because we're angry, or trembling because we're fearful, we feel sorry because we cry, angry because we strike, and afraid because we're trembling. According to William James, when we see a bear, we might know that we're afraid because we're running. The implication for rehabilitation as early as Riskind, publishing in 1984, was that we have the ability to regulate feelings through interoceptive and proprioceptive input to the brain by deliberate control, or I like to say choice, of our movement behavior. But we want to talk about how that happens so that it doesn't feel abrupt or strange or violent. So there have been a lot of studies. You can hear all about them in Dr. Shafir's TED Talk, how your body affects your happiness. Let's go take a look at some of the studies that we've done. Okay. How movement affects emotions. I'll give you some results from our 2016 study that identified Laban Bartenieff sets of movement variables, each of which predicted one basic emotion and negatively predicted the other emotions. Dr. Shafir contacted me to get involved in this study because her earlier 2013 study had demonstrated that moving certain actions that were associated with specific emotions can enhance that emotion. Here are some of the results from our statistical analysis. These are the motor characteristics, or the Laban-Bartenieff elements that predicted the feeling the following emotions. Take a look and see if these make sense to you. And you're welcome to look at the images alongside. Anger was elicited by movements that were strong, sudden, advanced, or direct, retreating, condensing and bound movements, and enclosing elicited feeling of fear. Passive or heavy movements, bringing the arms to the upper body, chest area, shoulder, face, sinking and dropping the head, elicited sadness. And happiness was elicited by jumping, rising, spreading, moving freely, lightly, or upward. Although rotation wasn't statistically predictive in this study because it was also, we only had it as one variable and we didn't look at repeated rotations as opposed to twisting, which was associated with fear. A later study found it to be present in most movements expressing happiness, and it was therefore added in as a variable in later studies. Okay. So how can we use movement for self-regulation of emotion, and how can the exercises that we're doing for rehabilitation not increase or give us, let's say if someone comes in and they're feeling pretty low, and I give them downward, heavy, or passive movements, as opposed to me, I might want to choose maybe some upward movements, or maybe just some forward and backward movement to give them a sense of power. So we want to start thinking about this overlap of self-regulation, and then later we'll talk about co-regulation with the therapist. So let me just summarize some of the findings from our 2016 study. Experiencing new qualities such as effort and shape that expands motor vocabulary, consequently makes these possibilities available on the emotional spectrum. Lessening motor qualities can also diminish or weaken specific feelings. So if somebody has been just feeling really angry for a long time, you know, and they're walking around with their chest like this, we might want to give them some activities that maybe take them to the side or help them have a little bit more fluid movement or balance in the way that they relate to the world. If that feels right for them, they might be out there as a protective need. We don't know what kind of need they have for that kind of protection or that kind of anger. So we don't want to make assumptions, but if the person would like to make those changes, how we choose our exercises can be supportive of that. All right, the most important thing here is that we don't want to do anything violent or abrupt. We want to do this change gently and gradually, because otherwise, if someone is putting their chest out there to, you know, keep people away from them, and we like make them do this, they might feel like they're a target. So we don't want to do something that's extreme or abrupt. We want to really find out what's going to work for that person. Okay. So our next study confirmed that the same LBMS movement sets that are significant to experiencing and eliciting emotion are also the ones that people recognize. So this is going to talk to us a lot about kinesthetic empathy, about co-regulation, about how we create community by sharing movement patterns. Almost all cultures in the world have dances or movement that are part of rituals that help organize and co-regulate the community. So this is helpful for us to know because the Laban Bartenieff components that we see as therapists might match those that contribute to experiencing and enhancing the emotions in our patients. The implications for this type of exercise were recognized by the New York Times, who picked up our research and created the Joy Workout based on movements that respond to the sets of happiness components. Implications for the type of exercise we recommend has potential to influence not only our body, but our emotions. All right, let's take a look at another study. So the same study, results from our study with Ayala and Meltzer, strongly indicate that specific components of movement contribute to our recognition of bodily expression of emotions, even when there's no intent on the part of the mover to express an emotion. So in our study, we just gave them the components and did not tell the movers who were filmed for this study anything about an emotion, but the people who looked at them moving those components without any intent were still able to pick up the emotions. So it was pretty robust. Likewise, observing momentary movement of these components alone in the absence of facial cues, context or intent of the mover to express an emotion was sufficient for the participants to identify the associated emotion. So if you think you're hiding what you're feeling that day from your clients, from your patients who walk in, most people are pretty good at reading a little bit and wondering what's going on. We just don't know how to interpret what we see, because only you know what's going on in you, and only our patients know what's going on in them. So our results, because it's both about recognition and about emotion elicitation, support hypothesized underlying brain mechanisms for emotion perception from body actions. And this was a new and important demonstration for this. Okay, lastly, these Laban Bartenieff components in unscripted, improvised movements concur with previous studies, and this lends strength to the conclusion that specific movement components and their proprioceptive feedback are indeed associated with the brain, with each emotion across cultures and studies. All right, let's take a look now at how we might use this in working with our patients. Let me just check the time. We're good. We want to remember that the body is an important locus of authority and autonomy and agency for every person, and that body autonomy is empowerment for the people we work on. And empowerment has to do a lot with well-being, as does regulating our emotions and our movement. So let's take a look at some principles for supporting gradual change. And I call it nonviolent because violence comes from the Latin root of the same root as wish, like volare. It's the same root as volition. So we don't want to force change on anybody. We're offering opportunities. We'll see how they support people. And within the Laban theory itself, this is another study from 2017, published in Frontiers in Human Neuroscience, in which we postulate 3 different methods that come from the Laban movement theory. Laban was a theorist who really looked at how does movement change in time and space. So 3 different principles that we can use to support graduate change. It doesn't feel abrupt, isn't violent, isn't inserting an opinion about change onto or imposing it onto a whole person who really oftentimes knows what's best for them. We're more like a menu. Here are some things you can try. So the 3 different ways that are helpful to structure this. One is a developmental progression. You can see what that would be by reading this paper. That basically in infants, each of these components of movement is acquired in a developmental way, so it's supported. So we might want to always start with breathing, the first thing that a baby does. It's a really great place to start. In Laban theory, there are also affinities between body effort, space, and shape. For example, it's much easier to lighten when we go up than it is to strengthen going up. If you've ever tried to hammer on the ceiling as opposed to hammer going down, the affinity for strength is downward. The affinity for lightness is going upward. There are different affinities. Typically, spreading helps us open our focus. Narrowing our shape helps us specify our focus. You'll see people narrowing when they want to shoot a bow and arrow. So the affinities can help access something. When I've worked with patients after a stroke, there's certain things that are really hard for them to do, but if I access the affinity, that makes it easier. Lastly, there are some space harmony principles about movement change and how it happens. So let me see if that's on the next slide. But the way to work with this in ways that are nonviolent and respectful, yep, I've got a little bit about that on the next slide. So how do we work with this? Because only 2 or 4 elements from each set were necessary to bring about the experience of each emotion. For the process of change, we don't have to change everything all at once. So we don't have to go from the fearful movement to the happy movement. Boom, that would feel really awkward and violent and not authentic. So you can see these 2 movements in the picture here. In one, I'm retreating and closing, binding, and moving backward. And in the other one, I'm spreading, rising, expanding. Am I jumping? Yeah, it looks like I'm jumping there. And moving lightly, maybe freely. If I made that many changes, it would feel really bizarre, like to shift my emotion in that way. So one of the ways that we can do, because each element predicted only one emotion, so as we lessen some elements, that can reduce the elicitation or the feedback from within the body, from the proprioception for that emotion. So let me talk you through a change, a nice gradual change. It might go from the top picture to the bottom picture. So if I'm doing all of these things, if I'm moving backwards and binding and enclosing and condensing, I might want to just lessen the binding a little bit so that instead of just going back, I can free myself up just a tiny bit and maybe begin to move from side to side. I might add some rhythmicity, which is one of the happiness qualities that might help me soothe myself. Then I might start to lessen a little bit of that condensing. I'm still not ready to spread, but I might feel like it's okay for me to condense or enclose a little bit less. And I might want to stay here with just the rhythmicity in the back, and I'm no longer giving myself full-blown feedback about fear. And then I might be ready to rise up and go down a little bit and just releasing from that backward direction. And eventually I might be ready to start rising up. So that's this idea that we wouldn't want to do that abruptly, I think. Here's our conclusion. We're at the end of the slides, getting ready for some questions and some dialogue. Movement is the way in which we humans adapt ourselves to our changing circumstances. We constantly reconfigure our shape and our effort in order to respond to our inner and outer stimuli. That means like our own thoughts, our own fears, and the ones that are coming from outside. The fact that so much of our movement is voluntary provides an innate mechanism for self-regulation that can be nurtured and strengthened. As we expand choices in our own body's movement, we become empowered to respond to our world using movement as a coping strategy, adaptive to our own needs. Over time, developing our capacity to make subtle movement choices can empower us with embodied skills for emotional resiliency. That's a conclusion from a 2017 paper. Here are the sources for all the papers that we've authored that relate to this topic. I also have some of the other studies that we drew upon, but I don't have a slide for those. They're just here on my presenter. So if you want to take a picture of this, a lot of these are open access. I think the only one that isn't is my 2013 study. I'm not sure if Shafir's 2013 study is, but this is where I've published some of the case studies. If you need access to that, I'd be happy to send it to you, which leads us to, how do you contact me? I'm a CMA, a certified Laban Bartenieff movement analyst. I'm a master somatic movement therapist and educator. I'm a certified Alexander Technique teacher with AMSAT. I'm associate professor of movement at the School of Theater and Music at the University of Illinois at Chicago. And here's my email. I'm gonna, is it time for me to stop sharing my screen?
Yes, I think that's good timing. We're right near the end, so thank you.
Great. I'm just
Right.
going to go back to the sources slide in case people need it. Great. Did I go over the time for questions?
Yeah, we're right at the end. We can still maybe take a question. I'll invite my co-host Peishan on as well. And if there was, we can just open it. If there's a participant who has a question, we can prioritize that. I also have one as well, but just see if there's any one attending live. Most of our viewers, of course, will be watching this after the fact, and you can always email questions to our presenter. Okay, just gotta help. All right, Peishan, it should work now. So
Thank you for the great presentation. So can you tell us a little bit about any research idea in the pipeline for you?
Oh, thank you so much. Right now I'm working on two NSF grants. The first uses movement and mind-body connections to support teachers who work in urban schools, particularly in neighborhoods where people don't have a lot of access to science learning and don't have a lot of role models in the neighborhoods for science learning. And so we're using movement and drama to bring joy to the learning of science. And also we're working through embodied cognition principles to help science learning and understanding science processes. So that's one of the grants that I'm a part of. And then I'm a primary investigator at UIC for a multi-site study looking at movement expression and training AI to do a better job for machine-human interfaces, because we've all had that experience when we're trying to, to say this is frustrating for me, and and the machine that we're interacting with has no idea how frustrated we are. So this is a large project led by Penn State University by James Z. Wong's lab in computer vision, and we're creating a computer infrastructure for bodily expressed emotion understanding using the Laban Bartenieff movement system to help train the machines to know when people are really upset or quite happy. Yeah.
That's cool. That's very cool. Do we have more time or that?
we can certainly run over a minute or two if we have another question. That would be fine.
Okay.
Yeah, I have a question, if that's okay.
Yeah, go ahead.
Okay, so I am a doctor, or at least I'm a doctor who just graduated from medical school, and I'm really into physical medicine and rehabilitation. That's kind of how I came across these lectures that you guys were holding. And I had heard about the Laban theory before. I'm a dancer as well in my free time, so I found it really, really interesting. And honestly, in my own personal experience, I've noticed a humongous change as I learned different styles of dance. And I just wanted to know, like, how much of this theory do we actually use in, like, say, for example, the interaction we have with a patient and a doctor in physiatry or neurology? Or is this more sort of like, no, you need to go to a very particular therapist who's going to help you with this? Or are we trying to, like, inculcate this into the medical literature as well? That's kind of my question. Like, is there any development in that regard? Does it help? Or do we have to specify, like, who we're sending the patients to and when?
Matt, do you want to pick up that question first, or do you want me to take it
I'll
first?
have you go, and when we conclude, I'll just make a brief comment.
Yeah, okay. So I think medicine is changing. And I think that you're lucky to have become a doctor now, when the mind-body connection is so accepted within medical practice compared to the generation that came before you. So I don't think it's a fight that doctors need to fight anymore in that sense. And as you know, although this might not be taught in PT school at first or in occupational therapy school, everybody who comes out of these trainings has opportunities for continued education. And so I would encourage people who have an interest in this to just say, yeah, I want to pick up some of that. Typically, when I have an intake with a patient, I'll use my Laban Bartenieff skills this is something that I wanted to talk about, but I didn't get a chance to because one of Matt's questions was, what else can we do in our practice? And this has to do with kinesthetic empathy. So if a patient comes in and they're moving slower than I am, I've just been running and running between patients. I can slow myself down. I can sustain my movement a little bit. If they're sinking a little bit, I can also sink a little bit. And what I've done by that is I've created a cohesive community. I'm in the same room at the same place, experiencing the same feedback from my body that my patient is experiencing. And then I'm not going to be doing things that are necessarily right for the rhythm that I was in before I came. I'm more attuned, and I'm also more able to understand what it might be like to be the patient. So I would say we can use this to develop our kinesthetic empathy and our co-regulation with our patients. Matt, do you want to add?
Yeah.
Yeah.
Were you going to add something, Abiha?
No, I honestly, I just liked the whole kinesthetic empathy. And I thought that, you don't really talk about doing that, but her putting it in words just really helps me understand that, like, that's really important to keep in mind when speaking to someone. Even on a general basis, I feel like it really helps develop that kind of empathy and connection with another person.
Yeah. Well, we are just a bit over, so we'll move to wrap up in just a minute. I just my comment is that as a physical therapist of nearly 26 years, I continue to struggle with unlearning the body as a machine, sort of reductionist biomechanical view of movement. And my profession is touted as movement experts. I would argue that there's very few physical therapists that are movement experts because of this challenge. It'd be nothing more than my greatest wish to see this integrated into the core movement education of all rehab professionals, especially those that work with movement like OTs and PTs. So that's the hope, but also agree it's continuing education. So I've been studying Dr. Shafir and Rachelle's work for the last 10, 15 years probably, and continuing to try to gain glimpses into how I work. So thank you for the presentation. Thank you for the work. Thank you to my co-host Peishan, to our viewers here and those watching this recording, and to ACRM for supporting our group. Peishan, any closing words as we move to wrap up?
Well, thank you very much, Rachelle. Yeah.
Thank you so much. I'm really glad to be here. I don't know if we want to stop the recording.